Hello, everybody. Today we have Dr. Chesley Leslin. He's the Chief Scientific Officer of Boston Lighthouse Innovation. It's a company that Dr. Chesley will talk about, part of the OCPM at Oncoclínicas. And thank you very much for being here, Chesley. So, I mean, besides that, ASCO it's a clinical conference. I mean, what do you think about the precision oncology importance on this meeting?
Yeah, well, first of all, thank you very much. It's an exciting time really for Oncoclínicas, OCPM, and really BLI when we think about the molecular diagnostic lab that we have now in Sao Paulo. It allows us to, the state-of-the-art diagnostics that we built down there. We're going to continue to expand our test menu and provide our patients with the diagnosis and treatment options that are, best in Latin America. So it's very exciting. It's awesome to be here at ASCO, as you know, because it's full of the kind of the technology that we're seeing. And I'd be curious to know what types of technologies you see coming in that you'd like to have at the OCPM.
Oh, thank you, Chesley. I think what we are looking now, I mean, we've been with a lot of things in the last years, okay? Mm-hmm. Liquid biopsy, MRD, and other things. But today, I believe that we are in artificial intelligence moment of a precision oncology.
Sure.
So what we see beyond like just looking and trying to by artificial intelligence to see if there is cancer or not in a slide.
Yeah.
So now we have companies and Oncoclínicas is working with one of them that also by artificial intelligence you can see not only if it's a cancer but also which kind of mutation you have in the tumor just by artificial intelligence and pathology. It's amazing that. So you can believe that if you have like a bad block or very few material and this patient needs something about a mutation, HFR mutation, KRAS mutation, even fusion. Now, like in 5-10 minutes, when they read the slide, so they can say that okay, this is a tumor, HFR mutated tumor or KRAS mutated tumor. So what do you think about that? You work also with IT and bioinformatics.
Sure, I agree completely. I think artificial intelligence, the technology itself, will most likely, revolutionize every facet of technology, including healthcare. So when we think about the exciting thing about working down in the precision medicine lab down in Sao Paulo, we have diagnostic modalities that we offer now. And as you said, we're bringing in new ones, and we can bring these to market to our patients much faster than we can do here in the US because of our ability to be fully integrated. So it's an exciting time. I agree completely with you. It's been great to go off and see a couple new technologies that I wasn't even aware about, like the complete blood count system that we saw today. A point of care system that will replace a massive, unit
it's amazing.
in a small box. So very exciting.
So we also been in a poster today,
sure.
Right? It's important to say that because we work with this technology, with the Archer technology, mainly with fusion, that it's a very complicated matter today and very important for the patient to know exactly which fusion they have. So I would like you to comment about that, Chesley.
So a colleague of mine from Mass General Brigham out of John I. Euphrates' lab, they did a study from the NIH match, and they found that 700 of the patients approximately that went through OncoMind had missed the fusions that our assay using Archer Fusion will detect. So that's exciting to kind of see 25 of the patients would have missed precision guided therapy. So that just kind of speaks to the power of our assay where we have both DNA and our RNA components. We can do that in-house without even ever needing to send out to any of the labs outside. So that just offers an integrated solution that's inside of the precision medicine program that should have all of Oncoclínicas really excited for the future.
Yeah, it's very nice because our test, the GS Infinity, is exactly. I mean, we choose the best way of looking fusions, and it's very difficult to find in the market like a test so complete like this.
Absolutely.
And also, I mean, with BLI reports and analysis, and make GS Infinity the best.
I
believe so.
Again, consider the source here. I do think it's one of the best tests on the market. I think it's a combination of both the expertise in the lab with how you guys do things down there and the software that we provide and the reporting system that Dr. Rodrigo Dietzman kind of has overseen the development of. It's the combination of a beautiful test for our patients.
Yeah, and I think, I mean, just to finish that, one of the things that we believe is the early cancer detection. Mm-hmm. So today also I was on one of the posters and it was like a guy saying that that he has like a special RNA, like an orphan RNA. RNA.
Yeah.
There are just like little pieces of RNA that only cancer cells send to the blood. So probably it can be like a future to detect a very early and not with a lot of things going on exactly in the blood. Right?
Yeah, when you bring that up, we're just beginning to scratch the surface on liquid and what we can do with those types of tests. So I find it really fascinating that they had that kind of opportunity, and I look forward to bringing that type of diagnostic modality into the lab.
Okay.
And into the clinic.
Chesley, thank you very much.
Thank you.
It was very nice.
Yes.
Thank you.
Thank you.